All right, welcome everyone. Thanks for participating and thanks for your patience as we got started. So today we're having a webinar about COVID-19 boosters. We know there's lots of questions out there, a lot of changing information, but wanted to let you know that today we have some great speakers here. Dr. Grant Colfax, our Director of Public Health, Dr. Elizabeth Kwan, who is with UCSF, our Associate Professor of Emergency Medicine, and also been part of our COVID-19 response, and Dr. Joseph Graterol, also from UCSF and been part of our COVID-19 vaccine team. So with that, maybe we can advance to the next slide and we can just go over a couple of housekeeping. So today's event will be recorded. We are working on the live stream still, but we will be recording it and it'll be available at the SFGovTV YouTube channel. In terms of audio and video, today's convening, we are by default having everyone muted and video is disabled, and video will be available for speakers only. In terms of question and answer session, to participate, please use the chat button at the bottom of your screen and send any questions to me, and I'm labeled Q&A Katie Tang. So again, please send all questions there, and you can do so throughout the event. And in terms of media, if there are any members of the media joining us at today's webinar, we will be prioritizing questions from members of the public during this Q&A session. And we have the email address here if you have any questions for our team, dph.press@sfdph.org. So with that, next slide, this is our agenda for today. So again, all talking about boosters. We'll start out with Dr. Colfax from DPH, our Director of Public Health. And then we'll go over to Dr. Joseph Graterol, who's the Assistant Professor of Emergency Medicine at UCSF and our DPH vaccine branch co-lead for the Ask an Expert program. And then we'll go over to Dr. Elizabeth Kwan, Associate Professor of Emergency Medicine at UCSF and part of our DPH vaccine branch operations as our planning deputy. And then we want to hear from all of you through the Q&A session. So with that, we'll get started and we'll turn it over to Dr. Colfax.
Well, thank you, Katie, and good afternoon, everybody. Thank you for joining us during this session. I expect there will be a number of questions about boosters. Boosters are important. They're important to get if you're eligible. And we are doing everything in the health department with other health partners across the city to ensure that vaccines for boosters are readily available. I am going to start by giving just a quick overview of where we stand with regard to COVID-19 in the city. We've had 50,747 cases of COVID-19 diagnosed in the city. That's cumulative. And unfortunately, we've now had 642 San Franciscans die due to COVID-19. And my condolences and the department's condolences to their families, friends, and loved ones. Right now, with regard to this fourth surge that we've been in for a while, the good news is that our cases and hospitalizations have come down from the peak. We are now averaging about 77 cases per day. And our current hospitalizations of people with COVID-19 in hospitals across San Francisco is currently 63. Of everyone eligible for of all San Franciscans, 75% have now completed the vaccination series. That is whether or not they're eligible. So that's the total percentage of San Franciscans vaccinated, which is a great number. We can continue to make progress with regard to that. And just to emphasize that the vaccines that we have are safe, they are saving lives, and they're key to improving our outcomes with regard to the pandemic. You can see here that the cases peaked at 309 on this last fourth surge. Again, now down to an average of 77 cases per day. And much of this surge, particularly with regard to hospitalizations, the vast majority of people who are hospitalized with COVID-19 during this fourth surge were not vaccinated. Next slide. And this is now looking at the currently eligible population for vaccines. Among people who are eligible for vaccines, residents who are 12 or older, 83% have completed the vaccine series. And among people who are the most vulnerable, 65 and over, we are at above 90%. So very good numbers with regard to this initial vaccine series. Again, we still have hundreds of people eligible for vaccine in San Francisco who have not completed their initial series. So I want to really emphasize that if you or if you know someone who hasn't been vaccinated yet and is eligible, please encourage them to do so. We have nearly 100 sites in San Francisco where vaccine is available. Most San Franciscans are within a 5 to 10 minute drive or walk to one of these sites. And in many places, drop-ins are available. And we'll get into more details about the boosters and how people can access boosters as well. But just want to emphasize the importance of these vaccines overall. Next slide. And to emphasize that point, this is San Francisco specific data where you see that among people who have been hospitalized with COVID-19 in the city, you see that rate of that difference in the rate of hospitalization by vaccine status. So people who are not fully vaccinated have a rate of 85.7 per thousand cases of COVID for being hospitalized, while people who are fully vaccinated, the rate is only 12.1. So these vaccines are working. They are also working to prevent death. We've seen this locally, we're seeing this nationally, and we're also seeing it internationally. So again, these vaccines are key to our getting out of this pandemic, and we need to continue to get vaccines in arms as quickly as possible. Thank you very much for joining us today, and really looking forward to a robust discussion around boosters and answering the questions you may have.
All right, perfect. So I'll go ahead. My name is Joe Graterol. I work at UCSF and also with the DPH vaccine branch. And I'm excited to be here to talk to you all about vaccines and boosters and as we continue to go through this pandemic. So next slide. So the first thing that's important to sort of clarify is, what are we talking about? What are boosters? You know, boosters aren't a new concept by any means. We have boosters for many other vaccines that we've all gotten growing up. What boosters are essentially, it's the same, and specifically for this type of booster that we're talking about, it's the same vaccine that you've received. And it's an additional dose because, as we know, over time, our immunity or our defenses to a particular type of pathogen or disease, in this case, COVID, wanes over time. So the booster, what it does is it basically helps you increase that level of immunity back to another safe, protective level that will last for longer. Does this mean that your vaccines that you currently have are ineffective? Absolutely not. As Dr. Colfax was saying, our vaccines and our vaccination rate has been crucial, and it's been very effective at preventing what we care about, which is severe COVID infection and hospitalization and death. And that continues to be the case. But, you know, as we move forward, this is an additional way to add more protection for yourself and for the community. So next slide, please. So the question is, should I get a booster? Well, the important thing to note is that right now boosters aren't eligible for everyone. They're eligible for specific populations. For one, the booster is authorized for patients or for community members who have received a Pfizer vaccine course and who meet specific eligibility requirements. And kind of to simplify it, it basically, the groups that are eligible are the groups that would most benefit from increased immunity because of their at-risk status. So older age, as well as comorbidities, are the particular groups that we're currently recommending to get a booster if you've had the Pfizer vaccine complement. So if you're wondering at this time whether or not you're eligible, whether or not you would benefit, it's a good time to talk to your doctor, because again, it's not a particular rush. It is a good time to get the vaccine now because it's available, and it's certainly something that you should do. But if you have questions, ask us or ask your healthcare providers. So next slide, please. So in terms of the timeline, why is it only eligible for Pfizer? Well, the reason, Pfizer has been operating a little bit on a quicker kind of course in terms of FDA authorization and CDC recommendations. But at the same time, we're expecting to have more information about Moderna and J&J very soon. There are scheduled meetings at the FDA regarding Moderna and J&J for later this month. So we do expect some more information and possible recommendations about boosters for these particular vaccines. But for now, it's mainly Pfizer that you can access. All right, the next slide. So who is currently eligible for a booster? As I mentioned, these are the particular populations that are currently eligible, mainly if you're 65 or older, or if you live in a long-term care setting from the age of 18 and up, or if you meet the criteria of being 50 to 64 years of age and have underlying medical conditions, or you're at an increased risk of social inequities. And as we all know, COVID has unfortunately impacted particular communities and groups differently. So if you're in a group that's been disproportionately affected, you would be eligible for this vaccine booster. And this is the recommendation by the CDC as to who should definitely get the booster. Next slide. There's also a population that is likely also to benefit from the booster at this point, per the CDC, and you're eligible if you happen to meet these criteria. So for one, if you're between the ages of 18 and 49 and have underlying medical conditions, those include lung disease, diabetes, and others, you'd be eligible, and you can self-attest to having those conditions when you go get the vaccine. The other thing that's important is that there's certain, obviously, institutional settings or occupations that are higher risk for COVID exposure. So if you happen to work in any of the types of positions below, then you would be eligible, and you can self-attest to getting the vaccine booster at this time. All right, next slide. And this is just to reiterate that for Moderna and J&J, boosters are not currently available, except if you are immunocompromised. In those cases, an additional dose of Moderna or Pfizer is available for you to get, and certainly recommend that you do so. And then for San Franciscans who have received J&J, you actually also can get a supplemental dose of an mRNA vaccine, specifically Pfizer or Moderna, after talking to a healthcare provider and self-attesting that you did so. It's important that you just have this discussion with your doctor to make sure that you would benefit, and that would be safe for your particular situation. All right, next slide.
Hi, everyone. My name is Liz Kwan. I'm an emergency physician at UCSF, and I'm also on loan to DPH to help with multiple different roles, including logistics deputy before, bringing vaccine staff and supplies all around the city. And now I'm helping with operations planning. I first want to say thank you, because San Franciscans have done such a great job during this pandemic, and it's really made our job easier, both as an emergency physician, dealing with capacity issues, and also for DPH, that people are obeying health orders, wearing masks, distancing, and then also our high rate of vaccination has really protected all of us. So thank you for that. And then also to qualify that, we are talking about boosters, and it's difficult to sort through all of the information. And usually science is getting a body of evidence, having discussions, and then figuring out what's the best path forward. And what you're seeing with a lot of the pandemic is we are making these decisions like in real time, and having to make decisions with incomplete information. So the discussion about boosters has been very hard to follow. And so we're gonna, we're giving you the recommendations, and some of this sounds a little bit squishy, but we're gonna try to help you figure out the eligibility definitions and then also how to get a booster shot. Next slide. So how do you get a booster shot in San Francisco? We really, really tried to lower the barriers for vaccine throughout the pandemic. And we want to emphasize that our priority in Department of Public Health is to get people their first and second doses. Like, that is the most important, like, very excellent evidence that these are necessary. So if you need a first or second dose, like you missed a second dose, you can drop in at any of our neighborhood vaccination sites. We'll have a QR code later in this slideshow, but you can go to SFGov, get vaccinated. You can also go to vaccines.gov. There's very wide open availability right now. Like, everywhere I checked, as of this morning, you can get a vaccine. So there are vaccine sites within 10-15 minutes walking of most people, most addresses in San Francisco. That is our very, very first priority. For the people who are under the recommended group for boosters, appointments are strongly recommended. But again, there's wide open availability at our vaccine sites right now. And as a reminder, the recommended group per the CDC are those who are 65 and older, 18 and older in long-term care settings. And the definition of long-term care settings is a broad definition. So people who are at a nursing home, at a supportive housing or assisted living, who might be in a rehab program or even a day program, like an intensive psychiatric day program, or a setting where they may be in contact with other people who are at risk and maybe in close quarters. And then anyone who's 50 to 64 with underlying medical conditions or at increased risk of social inequities, like Joe was saying. So all of these are self-identified. We want to lower barriers. If you identify as somebody who may be at increased risk because of underlying medical conditions, according to the pretty broad list, and increased risk from social inequities, you are eligible for a booster dose. And then the category of who may benefit from a booster dose, we are encouraging you to consult with your healthcare provider to see if you would have some shared decision-making, whether this is the right decision for you. Boosters are extremely safe, but the time frame of whether you need this right now or whether you need it later, that could be a discussion with your healthcare provider. Next slide. And how do I get a booster? So here's the QR code to link you to the SFGov Get Vaccinated website, and it lists all of the different pharmacies, clinics, neighborhood sites. But if you have a healthcare provider, if you're established with a healthcare system, Kaiser, Sutter, Dignity, or UCSF, or other provider groups like One Medical or others, there's a path to getting your booster shot through your healthcare provider. So we want to encourage you, if you have an avenue through your healthcare system, to check with them first. But there is wide availability throughout the city at pharmacies and other clinics. If you have any questions about how to get your booster shot, you can call our call center. The number is displayed there, 628-652-2700. You may have to leave a message, but people may call you back with some answers or refer you to the right place to get information. Next slide. So we identified a few frequently asked questions, and we welcome additional questions in the chat if you can message Q&A Katie Tang. So first of all, can I get my flu shot at the same time as a COVID booster? Absolutely, yes. We really want to encourage everyone to get a flu shot, because you aren't going to be able to distinguish, your physician, no one can distinguish flu from COVID-19. So it's incredibly important for you to get your flu shot, because even if it's just the flu or a cold and you have a fever and a cough, you aren't going to be able to go to school or go to work, and everybody will, all of our work and school and life as we know it is disrupted simply because people are coughing and having fevers. So if we can minimize the spread of flu, that's really important. Last year, we had almost no flu because everything was closed during flu season, but now workplaces are open, schools are open. So it's really important to get your flu shot this year. And it's absolutely safe to get your flu shot as well as your COVID booster at the same time. So studies have shown that there are, as far as we know, there are not any more symptoms from what limited information we have, because flu and COVID have only been administered recently together, but no additional worse side effects. It's completely safe. If you remember, kids get multiple vaccinations at the same time. So this should be completely safe. And many of our DPH vaccination sites offer both the flu and COVID, so you can get them both at the same time. Am I considered fully vaccinated if I don't get a booster shot? Yes. So if you have finished 2 doses of the mRNA vaccine, so Pfizer or Moderna, or 1 dose of Johnson & Johnson, you're considered fully vaccinated. So if you need to show vaccination proof for your employer, for getting into a restaurant or whatever, you are fully vaccinated. Can you mix vaccines and boosters? We are still waiting on more information about recommendations for mixing vaccines and boosters. And so we don't have any clear information. We have had people who've had mixed vaccines, and there's no evidence that there's any harm in doing it because of mistaken information or whatever. So there's no harm in it, but we don't know best practice yet. We're just waiting on more data. What should people who received Moderna or Johnson & Johnson vaccine do? We'll have more information later on this month because the FDA is meeting to discuss Moderna and Johnson & Johnson. So we don't have clear answers. If you are immune compromised, we already are offering supplemental or 3rd doses of Moderna. And if you've gotten Johnson & Johnson and have discussed with your healthcare provider that you need a supplemental dose, we've been offering those supplemental doses for months at this point. So please discuss that with your healthcare provider. What kind of side effects should we expect from boosters? From what we know, the side effects from the 3rd dose of an mRNA vaccine is very similar to what you may have experienced with the 1st or 2nd dose. Again, not any more severe as far as I know. Arm pain, sometimes chills or muscle aches, headaches, but nothing more severe than the 1st or 2nd dose. And will we need to continue getting boosters every 6 months? I wish I could tell you, but we don't have enough information to say. For right now, the vaccines are holding up really well to the variants. And so people who have been vaccinated are incredibly well protected from severe illness, hospitalization, and death. And we'll continue to gather information. What if I decide not to get a booster ever? Again, we are waiting for more information. For right now, the existing vaccines, if you're fully vaccinated, that means 2 doses of mRNA vaccine, Moderna or Pfizer, and 1 dose of Johnson & Johnson is incredibly protective from severe illness, hospitalization, and death. And you're less likely to get infected, even to have mild illness getting infected. So it may be fine to not get a booster ever, but we are waiting for more information on that. Next slide. That may be the last slide. Oh, here. So again, the QR code for SFGov Get Vaccinated and additional information on boosters on our website. Our website is updated frequently, and so the latest information about availability, any updates or health orders are all linked on our website. And the number to our vaccine call center is there, as well as links to the CDC and SFDPH COVID-19 vaccine information. And with that, I will send it back to Katie.
Thank you very much, Dr. Kwan and Dr. Colfax and Dr. Graterol. We're going to go to the Q&A session, although I know Dr. Kwan had already addressed some of the frequently asked questions. if you have any additional ones, please do feel free to drop them into the chat. We did receive a question and asked if the panel can discuss some of the recent media reports of longitudinal research showing less efficacy of Pfizer vaccine compared to Moderna at the 120 days, well, over 120 days mark. What does this mean for those vaccinated with Pfizer? And what does it mean for booster recommendations?
I can start with that. So the booster recommendations were made because Pfizer submitted information about their particular vaccine. So they don't consider Pfizer versus Moderna in those decisions. And the Moderna vaccine had a couple of advantages. First, there's more mRNA in the Moderna vaccine, and they were spaced out more. So your immune system had a little bit more time to respond to that vaccine. And also, if you remember, Pfizer was the first vaccine that was released. And so the very highest risk folks got vaccinated with Pfizer. And so that's healthcare workers that are exposed to COVID more than most people, people in nursing homes, and the 75 and older. So it's hard to say like whether one is better than another, but the FDA and CDC will consider each vaccine and their data separately.
Okay, thank you for that. We received a question. Someone had scheduled a booster shot appointment, but it sounds like they need to reschedule. It seems like this is something where it really depends on the particular clinic that someone went to and would need to reschedule in that way. I don't know if there's anything else you want to add there, but that's my understanding.
I can't speak to that particular situation. CVS, Walgreens, and other pharmacies are under federal rules. And so there may be people that have heard that people have gotten boosters before, and that was because it was from a pharmacy chain and they're not subject to the same rules as the health department. But now these should be widely available everywhere, and there shouldn't be many barriers at this point. So hopefully that person that had the question was able to reschedule.
All right. What if someone lost their vaccination card and somehow can't access their electronic version and they need to, provide that as they're trying to get their booster dose? What should they do?
This is posted on our webpage about how to proceed. The first place to go is if it's available, is your healthcare provider that provided the vaccine. They will be able to look it up. If that's not possible, say you got your vaccine at the City College drive-through or Moscone, you can call our call center for additional help.
All right. Someone just wanted a little bit more clarification. I think when Dr. Graterol was stating that those who receive J&J with compromised immune system should get the booster. Perhaps Zoe, I think there was a slide that showed who's eligible right now and what happens if you're a Moderna and J&J recipient. If we could bring that up, I think that might help clarify what was meant by that. And if anyone wants to speak to it as well in the meantime, that would be great. Just to clarify, if you got J&J or Moderna and you have if you're immunocompromised.
We've been providing the third dose for people who have been shown by studies to not have as much of a response to vaccine due to a medical condition. So if they have immune suppression or immune disorders, they're not really getting a booster, they're really getting a third dose. And that also applies to Johnson & Johnson. We've added an mRNA dose, not with great evidence, but just because we could see that the vaccine efficacy of Johnson & Johnson was decreased. So again, this is like having to make decisions with not the best data to support it, but given the urgency of the situation. Sorry to interrupt you, Joe.
No, the only thing I'll add is there might be some questions about, what does it mean to be immunocompromised? There's several groups that fall under this. It can be cancer treatment, it can be active or untreated HIV, it can be stem cell transplant, organ transplants. If you have a question, you can always discuss with your primary care provider to see if you would be eligible by that criteria.
And we're not requiring doctor's notes. We know that there's not, we want a lower barrier. So we're asking for an attestation, and we're asking people to have a discussion to make these decisions, but we're not checking. You don't have to have an ID. You don't have to have a doctor's note. You don't have to have your job ID card if you're in an at-risk or high-risk job. So we're really trying to support low barrier access to vaccine.
Great. All right, we have another question. For people who received J&J, is there a sense of whether a second dose of J&J or an mRNA vaccine should be next? Sorry about that interruption. I think we were just getting around to some of the questions, and then we all got kicked out. If you want to re-enter any of your questions into the chat to me, that would be great. Again, really apologize for what had just happened. All right, everyone. I do see some questions that are being shared with us. So I will go ahead and I think you can all see them as well. But there was a question about clarification in terms of supplemental doses and booster doses. And I know that we had tried to distinguish that early on, but perhaps either Dr. Graterol or Dr. Kwan, if you can help us explain the difference between supplemental and booster doses. And really, it sounds like, I mean, they are similar, so, or if not the same thing. They're all boosting your immune systems, but I'll let the experts address that.
Yeah, I think this is probably more like shop talk at this point, because everything is commonly referred to as a booster. But for people who are immune compromised, we were considering it a third dose of an mRNA vaccine, because we've seen from studies that people who have a immune compromise, they don't mount the same immune response to 2 doses. So that's a third dose. And then the supplemental dose was to give additional protection to people who had Johnson & Johnson who were at higher risk. So not everybody that had Johnson & Johnson, but for people who also had, concerns about their particular risk. So in the end, they're all probably commonly considered boosters. And so it's hard to distinguish. It's more for, as they rolled out, this was the terminology we used. But boosters, as we're talking about today, are additional doses after you're considered fully vaccinated. Does that make it any clearer?
The easiest way that I've thought about it is that essentially these additional doses, they're all boosting your immune system. So whether you call it a supplemental dose or a booster, it's all achieving the same end goal.
Yes.
All right, thank you for that. There was a question about whether the department has plans to conduct on-site building-wide booster shots, similar to some of the efforts done previously for first or second doses going into buildings like SROs. And so what are sort of the plans around that this time around for boosters?
We still have our mobile vaccine team, and we have that capacity. So the landscape is very different now. Before, when vaccine was scarce, it was hard to find another way to get vaccinated. But now we are trying to encourage people who have the ability to go to other places, either their healthcare provider, the pharmacy down the street, or whatever, to take those opportunities, because vaccine is widely available, appointments are widely available, because it is a huge effort to do these mobile vaccine events. That being said, we are really committed to having low barrier access to vaccines. And so if you have a hardship, you need a vaccination, especially if you need a first or second dose or to complete your series. And we have ways to help you, either arrange transportation if you call our call center, or bringing the vaccine to you. So we've done hundreds of people who are homebound in San Francisco with our mobile vaccine team. And we also offer Vax to You, which is a program that if you and 4 other people, so like say 5 people, need a vaccine brought to you, then we can bring it to you. However, our priority will be people who are getting first and second doses. If you have 5 people that need a booster, we'll have to triage based on the demand.
Great. I think you sort of addressed this actually in this question, but someone had asked if there's a concern about vaccine shortage when more people qualify for boosters. And so I know you said at the moment we have supplies widely available, and I know you can't predict the future, but any other additional thoughts you want to speak on that?
We have looked into it, and we've been keeping a month's supply on hand in the Department of Public Health to make sure that all of our sites are well stocked. We don't anticipate a shortage of vaccine. And for the people who are concerned, we are certainly as concerned as anybody about vaccinating globally. And especially after we've taken such care to really waste as few doses as possible in the beginning of this vaccine launch, that it really hurt, like literally was so difficult to move towards like no missed opportunities and have to waste doses here and there because we wanted to reach everybody possible. So we have tried to escalate and advocate for vaccines globally, but I can assure you, after talking, we've even debriefed, we briefed the White House about our concerns that the dose that you will get in your arm as a booster was not going to end up in another country, because this is federal property. There's no way for us to rehome it anywhere, and vaccines are widely available. So we don't anticipate a shortage, and the federal government, who owns all of the vaccine, is working on bringing vaccines to other countries.
Well, thank you for briefing the White House, Dr. Kwan. Do you know if boosters will be effective against variants, so whether it's Delta or others?
This one is definitely predicting the future. And ultimately, if we let the pandemic go and we have under-vaccinated areas, we have risk of developing more variants. And so the sooner we can get the rest of the world vaccinated, the better. But that is definitely predicting the future. I can't say.
All right.
Yeah, and I'll add, at least with Delta, the vaccines still appear to be effective, and some of the information we have about that is locally, and in terms of boosters, there's data from Israel to support that even in the presence of Delta, these vaccines and the booster vaccines are helpful. Extremely helpful at preventing severe disease and helpful at also decreasing mild disease or infection.
Okay, great. And I think that's similar to a question about will booster vaccines reduce the likelihood of someone spreading COVID-19, or will it just protect that person? So I think you touched upon it a little bit, but it'd be great if you could elaborate.
Yeah, absolutely. Yeah.
Go ahead, Joe.
No, I just to kind of complete the thought there. Ultimately, if we're able to protect you from getting any infection or mild infection, then yes, you'll decrease your likelihood of spreading into the community. Does it decrease the likelihood of you getting COVID down to 0? No, but it certainly lowers that risk. So by getting the booster, you are both protecting yourself and protecting others.
And it is confusing because as single studies, roll out, then there'll be a headline in the newspaper. And usually with science, we get a body of evidence, we consider it all, and then we make, then we kind of consider it, discuss it, and then say, hey, this is the consensus, that this is the effectiveness, or this is your likelihood. But multiple studies have shown that you're actually less likely to get infected. So if you're exposed and you're vaccinated, you're less likely to be infected. And depending on the study you read, it may be like 8 times less likely to get infected if exposed compared to somebody who is unvaccinated. So there is a role for getting vaccinated to reduce the spread of COVID. As far as like whether getting a booster, that the studies do seem to show that you're less likely to get infected. The actual degree to which that is the case is, still a little bit in the air because we're working with very limited studies. Israel was the first to do a wide rollout of boosters, and that started in July.
Thank you. What about for folks who, have been fully vaccinated? It's been past 6 months, and let's just say that they are eligible. Should people kind of wait, or do you think that they should hurry up and get the booster? Any thoughts on that?
As the operations person right now, or one of many operations folks, I would say this is a great opportunity to get your booster dose because we have all of the infrastructure and staffing to provide those now. And there's like wide open appointments. And so I cannot emphasize this enough. Everybody remembers getting that first dose and it was difficult and you had to check a website. You can walk into any Walgreens at this point and probably get a booster. So I would encourage people to look on the website, talk to your healthcare provider, figure out where's the best place for you to get your booster if you're eligible.
Okay. Someone asked this question, and I know you addressed it earlier, but perhaps given the glitch that we just had, they're wondering if it's safe to get vaccinated, the booster and the flu shot at the same time. So maybe if you could just address that one more time. Thank you.
Oh, yes, it's absolutely safe to get your booster and flu vaccine at the same time. There's no evidence that you're going to feel any worse. And as a reminder, kids get multiple vaccines at their well child visits pretty routinely. And so it's very safe. The other thing I will say is there was some concerns before about the mRNA vaccines causing myocarditis, especially in young men. And a couple of days ago, a study was released and showed that if you looked, it was looking at Kaiser patients. And as you all know, Kaiser is a healthcare system. So they track all of their patients and they essentially have all of their data on their patients and they're followed through the same electronic medical record. And of over 2 million patients that they followed after getting the mRNA vaccine, it was like 15 cases. So a very small number of myocarditis cases, and all of them were well. There were no long-term sequelae. People get myocarditis from COVID. You can get myocarditis from a cold, from the flu. So it sounds scary, but it's actually, as we get more data, really unlikely to happen. And also the outcomes, even if you were to get myocarditis, are, basically you get some supportive care, which means you're, get some rest, maybe take some ibuprofen and you're fine.
Okay, and I just wanted to clarify this. The individual corrected the question, or clarified the question, which is that if someone who has not been vaccinated yet, and they want to get vaccinated for the first time and also the flu shot, whether that is safe to do so.
Absolutely safe to do so.
Okay, great. Thank you for
Please
clarifying.
do. That would be an amazing thing to do.
Yes, like you will get cheers. If you go to any vaccine site right now and say this is your first dose, like people may be cheering and dancing. Like it warms my heart every time somebody has come around to wanting to get vaccinated.
Okay, great. And thank you to that individual. And yes, we are still offering some incentives. The Giants tickets we've ended that program as they were only good for games happening in September. However, we do have some other incentives going on right now, including free tickets to the California Academy of Science for nightlife as well as for daytime. So definitely check out our website. We have those incentives listed there for our events. And I know that we have about 5 minutes left, and I just wanted to let everyone know that DPH will be hosting, in conjunction with the Department of Children, Youth, and Families, a series of town halls specifically to discuss pediatric vaccination sometime in mid-October. So as we are eagerly awaiting information and guidance around vaccinations for youth age 5 to 11, we will be timing it so that once we obtain that information, we'll be sharing that out with all of you. So more to come on that. And I don't see any additional questions in the chat at the moment, but just wanted to thank you all for joining, especially those who returned after getting kicked out of this meeting. Want to thank Dr. Kwan, thank you, Dr. Graterol, thank you, Dr. Colfax, who I know had to leave earlier, but for all of your work throughout our entire COVID response and vaccination efforts, for being on loan to us and helping us as we've rolled out vaccinations, now boosters. So with that, then we'll probably end just a few minutes early, but just again, thank you everyone, and let us know if you have any other questions. All right.
Thank you, Katie, and all of the support staff.
Yes, thank you. Take care.